my name is Nick MacLeod. I'm a consultant clinical oncologist. I'm based at the Beatson and currently Ross Hall Hospital. I started university in 1996. That was quite a while ago. I think the main reasons I was interested in becoming a doctor were to do a job that made a difference and try and help others. Beyond that, I can't remember exactly, but certainly I've enjoyed the career that I chose. So I'm quite happy with the decision that I made back then. So I had been a doctor for 2 or 3 years before I made the decision to go into oncology. A friend of mine started working at the Beatson, and I met him for a coffee, and he was really enthusiastic about the job, the sort of types of patients that he encountered, the amount of research that was going on in oncology, that things were always changing and evolving, and it kind of sparked my interest then. So I looked into a bit more detail, spoke to a few other consultants, and became a registrar at the Beatson, and I've thoroughly enjoyed my time ever since then, and I'm really pleased with the decision that I made. There's lots of aspects of the job that I enjoy. The people I work with are excellent and very pleasing to work with. The patient contact I enjoy as well. You see patients at all aspects of their cancer journey, from diagnosis right the way through. And I think also often when you first meet patients, they're very vulnerable at the time when they've just often been diagnosed with cancer. It can be a very difficult time. So being able to meet with patients and hopefully reassure them of certain things and being able to answer questions that they've got and potentially give them a management plan is very rewarding, because I think the fear of the unknown is a big issue with oncology patients. When they get diagnosed, don't really know what's going to happen to them, how they're going to be, what sort of treatments are going to have. So being able to sort of take patients from that and map out a management plan and what treatments we're planning to offer them, I find a very rewarding thing to do. I like to think I'm quite easy to talk to. I listen to my patients as best I can, and I usually think I'm hopefully quite good at explaining things to patients in a way that they're going to understand. And also, I think it's very important for patients to know that their doctor is keeping up to date with new advances in technologies. Oncology practice is changing all the time, and so I regularly attend meetings and international conferences, so I'm up to date with the new developments in oncology. I think is very important in all specialties, but I think almost particularly in oncology when it changes so much, and I think patients appreciate that. Just getting to know the patients is something that I enjoy. You see patients often at several consultations throughout their treatment, and you're getting to know them as individuals and helping to formulate decision plans. I very much feel that any decision about treatment isn't usually the case of a doctor telling the patient what to do. It's explaining the options to patients and working out what is the best option for them. And because you can have two patients who are very similar in paper who want very different things, and it's trying to work out what that individual patient wants. I think that's important, that you treat patients individually, not as a whole group.